Hello students, my name is Dr. Chandresh. I am Senior Demonstrator in Department of Anatomy, Government Medical College, Bhilwara, and today I'll be taking a demonstration on pubis bone. As it has come across my knowledge that the ischium and ilium part of hip bone has already been demonstrated to you. So today we'll take the last bone, that is the pubis bone of the hip bone. So let's get started. So before commencing the demonstration, I would like to give you a brief outline of what we'll be studying today. First, I would like to give you a relevant information about hip bone. Not that the lecture is on hip bone, but still I would like you to know that how to determine the side of the hip bone, how it is anatomically situated in our body, why it is constituted of three bones, namely ilium, ischium and pubis. Then on the second part, we'll move specifically towards pubis. We'll study about its various rami, borders, surfaces, body, etc. Then third, we'll go towards its attachments and origin on the pubis bone. And lastly, we'll see the relevant clinical anatomy of the pubis bone. So let's get started. So, when examiner asks you to pick up a hip bone, his very first question might be that how to determine its side. So to determine the side of a hip bone is again very easy. Now we'll have to see the acetabulum. This is the acetabulum. You must have learned in your previous lecture. It lodges the head of the femur. So acetabulum has to be on lateral side. Now the acetabulum can be on lateral side like this or like this. Still we haven't got the side of the hip bone. Now this is the ilium. So the spreaded ilium part has to be upwards. So like this it could be upwards and like this it could be upwards. But then again we haven't determined the side yet. But this is the pubis. So the thin pubis is on the anterior side and the thick ischium is the posterior side. So this is the hip bone of the left side. Okay. Now, how do we determine its anatomical position or how it is situated in our body? Now, the pubic tubercle, this is the pubic tubercle. I'll be telling you about pubic tubercle when sooner we'll be studying this pubis bone. So this is the pubic tubercle, okay, and this is the anterior superior iliac spine. So they lie in the same coronal plane. This is the coronal plane, okay, and the pelvic surface of the body of the pubis. Okay, this is the body of the pubis and this is the posterior surface. So the posterior surface is directed backwards and upwards. It is directed backwards and upwards. Okay, and this is the symphyseal surface of the pubis, which is again lies in the medial plane. Okay, this is the medial plane, this is the coronal plane. This is how the bone is situated in our body and it articulates with the other bone to form a pelvic girdle. You will have a class on pelvic girdle as well. So the next question which sometimes arises is that why this single piece of bone is divided into three bones. The reason is that the bone is not the hip bone is not always united like this. During adolescent and early natal life, the hip bone is joined to each other by a cartilage which is unossified and divides the bone into three parts: the ilium, pubis and ischium. But as soon as a person turns into an adult, the cartilage gets ossified and forms a single piece of bone called the hip bone. Now we'll study about the pubis. Okay, the pubis forms, this is the pubis. Okay, so the pubis forms the antero-inferior part of the hip bone. Now the question arises, what forms the posterior-inferior part? The ischium forms the posterior-inferior part. This is the ischium, forms the posterior-inferior part. So this is the hip bone of the left side. Okay, this is the inner aspect. Okay, and this is the outer aspect. So I would like to get oriented according to this view. Okay, now this here is the pubis bone, inner side, and if you look from the outside, this part up till here forms the pubis bone. Okay, then the pubis bone forms the antero-inferior part of the hip bone. Anteriorly, this part is anterior, this part is posterior. So the pubis is forming the antero-inferior part of the hip bone, and it forms the 1/5 of the acetabulum. So if we'll move backwards, it's from the anterior 1/5. This is the anterior 1/5 of the acetabulum, and it forms the anterior border, okay, of the obturator foramen. It has three parts, namely the body. This body is anterior, okay. Superior ramus, which is superior and going towards laterally, and inferior ramus, which is again inferior but again going outwards, that is laterally. Okay, now we'll talk about the body. Body has superior border. The body has superior border. I'll like you to take a closer look. The superior border, this is the superior border of the body, which is called the pubic crest, and it laterally terminates into, this is a tubercle, this is crest, and this is tubercle, and laterally terminates into pubic crest. Okay, now it has three surfaces. This one is the anterior, this one is the anterior surface, this one is the posterior surface, okay, or also known as pelvis surface, and this one is the symphyseal surface, also known as, it's in the middle, so it's called the medial surface. It articulates with the opposite pubis to form the pubic symphysis. Now we'll talk about the ramus. The ramus extends from the body up till to the obturator foramen. Okay, it has three borders and three surfaces. This is the, as you can see, superior border. The border in front of it will be, this is the sharp border called the anterior border, and just below it is the inferior border. The superior border is also known as pectinate line, which terminates into arcuate line. This is the arcuate line. The anterior border is known as obturator crest, and this is the inferior border. The surface between the superior border and the inferior border is known as the pelvic surface, and this surface between the superior border and the anterior border is known as the pectineal surface, and the last surface between the inferior border and the anterior border, this surface, okay, is known as the obturator surface, as it's forming the obturator foramen. This is the inferior ramus. As I told you, inferior ramus is inferior and goes laterally. Okay, this is the inferior ramus. Okay, so the inferior ramus again has the inferior ramus extends from the body of the pubis to the ischial ramus and forms, along with the ischial ramus, form the ischiopubic rami. Okay. Now we will learn about the attachments on the pubis bone. So most of the time, the most common question, if examiner wishes to ask, although it is rare that examiner asks question from pubis, but still if he wishes to ask, the most common and sought after question will be the attachment on the pubic tubercle. Okay. Or the examiner may ask that what are the attachments of the inguinal ligament. So most of the students are able to answer that the inguinal ligament attaches to the anterior superior iliac spine, but they forget that its medial end gets attached on the pubic tubercle. This is the a bony projection sort of thing. This is the pubic tubercle. So pubic tubercle gives attachment to the medial end of the inguinal ligament, and it also gives attachment to the ascending loop of cremaster muscle. Likewise, there are two attachments on the pubic crest. What are those two attachments? It gives rise to the lateral part. The lateral part gives rise to the lateral head of the rectus abdominis and the pyramidalis. Then the anterior surface of the body of the pubis provides attachments to 5 things. 1 ligament and origin of 4 muscle. So the anterior surface medially, this is the anterior surface. This is the anterior surface of the body, of the pubis, and medially there is attachment. Medially there is attachment of the anterior pubic ligament. Then origin of the adductor longus. Between the pubic crest and the margin of the symphysis, there is an angle, and in between this angle originates adductor longus. Now, gracilis is another muscle which originates from the anterior surface of the body of the pubis. It originates from the margin of the symphysis, gracilis. Then adductor brevis originates lateral to gracilis, and this part, this is external part, as you can see, external part. So this part give origin to what? Obturator externus. Here there will be origin of the obturator internus, on the posterior surface of the body of the pubis bone. And in the middle there is origin of the levator ani, and medial to the attachment of the levator ani, here there is attachment of the puboprostatic ligament. Now, as I told you before, this is the pectineal line. The pectineal line at its medial end here gives attachment to the attachments to the conjoint tendon. In front of the attachment of the conjoint tendon, there is attachment of the lacunar ligament. Here there is attachment of the pectineal ligament of Cooper, and throughout the pectineal line there is origin of the pectineus muscle. Okay, and the upper part of the pectineal surface, this is the pectineal surface, and upper part of here also gives origin to the pectineus muscle. And the pelvic surface, this is the pelvic surface. Okay, it is crossed by the pelvic surface, this is the pelvic surface, is crossed by round ligament in female and ductus deferens in male. So these are the simple attachment of the pubis bone. Now the relevant clinical anatomy related to the pubis bone is about pubic tubercle. The pubic tubercle forms an important landmark for determining the two very important openings, that is the saphenous opening and the superficial inguinal ring. Why these openings are important? You'll get to know about this in your fourth year when you study surgery and when you have to do various tests to determine the direct and indirect inguinal hernia. For now, you should know the location of these two openings with regards to pubic tubercle. So the saphenous opening lies 1.5 inch below and lateral to the pubic tubercle, and the superficial inguinal ring lies above and lateral to the pubic tubercle. So that was all about pubis bone. I hope that you understood it. We'll meet again in our subsequent demonstration. Till then, be safe and please study whatever we have taught you in your demonstration and lectures, because that would be helpful when you come again after this long COVID vacation. Thank you.